Welcome back, everybody. We continue to follow one of the big stories of the year. Healthcare reform is now passed in the House, and it's on its way to the Senate now.
But the bill narrowly approved in the House over the weekend doesn't appear to have much chance in the Senate. So what will happen once it gets there? News 13's Greg Lagerquist is live now with the latest on this healthy debate.
Well, thanks very much, Kim and Jeff. That House vote couldn't have been any closer, really. 220 to 215. 39 Democrats voting no. 1 Republican voting yes. But the Senate has its own versions that it's working on. Joining me right now live from Washington to talk about the House vote and what's going to happen now in the Senate is Maine Senator Susan Collins. And Senator, thanks so much for joining us tonight.
Good evening.
We've heard your friend and colleague Joe Lieberman of Connecticut saying that he just can't vote for the version that passed in the House, largely because of that so-called public option. Do you feel the same way about that? Do you believe the public option has any chance in the Senate right now?
I don't think creating a government-owned insurance company is the answer to our problems. But my number one concern is that the House bill, and indeed the Senate bills, would actually increase the cost of health insurance for a lot of middle-income families and small businesses. I think we need a bill that would do the opposite, that would help rein in the cost of health care.
We've already heard Congresswoman Shelley Pingree saying today that she thinks this is going to help Maine, the version that passed in the House. You disagree with that, then, it sounds like.
I do disagree with that. As I analyze the bill, I believe that it imposes unfair penalties on small businesses that are trying their best to provide health insurance for their employees. And I think for the vast majority of people who won't qualify for subsidies, that the cost of insurance will actually go up as a result of these bills. That doesn't mean that I don't think that we need a bill. I do, and I'm working with a bipartisan group of senators to try to come up with a bill that will help rein in health care costs.
And Senator, again, playing off of the vote over the weekend that we saw so narrow there on the House side, what about a compromise on the Senate side? We've already heard, for example, your colleague Senator Snowe talking about possibly having a trigger option that would kick in a public option only if the private sector fails to meet certain benchmarks. Where do you stand on that trigger right now?
Well, first, let me say that Senator Snowe has worked so hard on this bill, and it's a lot better because of her efforts. I don't support the trigger approach, however, because I just think that delays the government-owned insurance company from being created for a couple of years, but inevitably it would be. I don't think that makes sense. I think it would undermine the private markets, and CBO has said that the costs would actually be higher for insurance offered in the so-called public plan. So I don't think that's the right direction to go. But there's a lot we could do to reform insurance, to make it more competitive, to protect people who have pre-existing conditions. So we do need to act.
And Senator, no secret, Maine does have some of the highest health care costs in the country, some of the lowest amount of competition when it comes to health insurance. Are you convinced then that something will be done, and perhaps as early as this year? We keep hearing that possibly sometime maybe mid-December there could be a vote on the Senate side.
I think we will take up the bill in December and have a vote, but we can't rush this. We need to get this right. I personally thought it was appalling that the House debated a nearly 2,000-page bill for only one day on a Saturday with limited amendments. This is too important. It affects every single person in this country, every healthcare provider, every hospital, every business, state and local governments. We need to get this right, and even if that means taking a little more time, we should do it.
All right. Senator Susan Collins joining us live from Washington. Thank you for sharing some of your time tonight to talk about this issue, Senator.
Thank you, Greg.
And we want to send it back to Kim and Jeff.
All right, thanks, Greg.